If you have any of these 7 signs, you may have folate deficiency. Folic acid, also called folate, methylfolate, or vitamin B9, is an essential vitamin for our body. Many pregnant women take it since folic acid helps in many essential body processes for fetal formation. And more, it is necessary for cardiovascular health and the nervous system. With so many benefits to our body, the lack of folic acid can be quite harmful. So pay attention to these 7 signs of folate deficiency. Do you suffer from frequent and intense headaches? The cause for it might be the lack of folic acid. Folate deficiency interrupts the oxygen supply to the brain, and this is directly linked to the lungs. The consequence is shortness of breath and chest tightness. Who could imagine that folate deficiency affects our mental health? Its lack can cause depression, weak memory, and poor concentration. Severe digestive issues such as diarrhea, acute stomachache, vomiting, and nausea are other signs of folate deficiency. 2 seemingly uncommon signs the body gives when lacking folic acid are weakness and mouth ulcers. In addition, folate deficiency also causes fatigue, pale skin, pain in the mouth, and swollen tongue. Another common sign of folate deficiency, which usually goes unnoticed by most people, is the numbness or tingling sensation in hands and feet. Palpitations are another signal of folate deficiency and can cause many cognitive issues, such as generalized anxiety disorder and ringing in the ears. To make sure you have enough folic acid, eat beans, lentils, peas, beets, broccoli, Brussels sprouts, and spinach, which are rich in folate. The vitamin is also found in most green leaf vegetables and breakfast cereals.